A very warm welcome to this first local outbreak engagement board meeting of 2021. For the benefit of members of the public who are watching either in real time or later, my name is Howard Wollaston. I'm Executive Portfolio Holder for Public Health, Leisure and Culture. I chair this board, which meets every other Monday. We are clearly living in very troubling times, but I'm hopeful that the combination of the rollout of vaccinations combined with a disciplined approach from the public can mean that we can get back to near normal life in a few short months. I'll be assisted today by James Townsend as clerk for the meeting and by Kevin Griffin, who is the Zoom host. I will now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, the chairman will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by show of physical hands. If we need to adjourn the meeting for any reason, then the chair will advise the board of the revised time and date of the meeting. If it is a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Thank you. Do we have any apologies?
We have apologies from Shire Rose Claridge.
Yeah. Moving to the minutes, I have one I've spotted, which is point 63, when we have Meriden down as Meriden Peachy Pierce for some reason. Do I have any other comments on the minutes? I can't see any blue hands up there. Can I ask therefore members for declarations of interest? I see none. We have changed the agenda slightly to deal with vaccinations, and clearly the vaccination process is nothing to do with the council but the responsibility of the NHS. I'm delighted therefore to welcome Debbie Simmons, who is the Nurse Director at West Berkshire Clinical Commissioning Group, to say a few words.
Hi everybody, can everyone hear me?
Yes, Debbie, and welcome. Now you've now gone on mute, Debbie. That's better.
Is that all right?
Perfect.
I don't know why I must have touched that twice, sorry. So thanks for asking me to come along. So I've come along to give you a bit of an update on the vaccine programme. Obviously very hot topic at the moment, so I'll do my best to update you as best I can and to answer any questions that you might have. I'll just start by saying that the vaccine plans are continuously evolving, as you can imagine, and changing, and basically in view of the sort of vaccine availability and the type of vaccine that we're actually getting delivered to us. So it does change on I would say it's almost like an hourly basis, if not daily. So please bear with me that what I'm saying today might not be the same the same tomorrow once we get another national announcement. But this is where we're at the moment. And I think I just need to start by saying that to ensure sort of accurate communication is given, as well as protecting the vaccine sites when they go live, we are actually we're prevented from actually sharing too much of the detailed information with anybody until it's actually announced via the NHS England team, who are actually sort of managing the comms. But I'll do my best to give you an accurate position of where we're up to at the moment in West Berkshire. So the hospital hub, which was our first vaccination centre in Berkshire West, went live on the 14th of December, and that is in Wokingham Hospital. So the hospital hub site, although it's in Wokingham, is actually there to deliver vaccinations to all of the social care and health staff who are in the category 1 for delivery. So basically opened up on the 14th of December, did 2 rounds of the Pfizer vaccine. So the Pfizer vaccines delivered in 975 vaccination boxes, and they did 2 rounds of that before Christmas. And then they went up and running again as of this morning, and I'm pleased to say that they've been able to double the amount of vaccinations they're going to do each week in January. So basically they're going to be running 6 days a week now and having 2 lots of delivery, which is really positive. So that's sort of like, just under 2,000 vaccines a week. So we've worked with local authority colleagues across Berkshire West, and we've opened up all of those appointment slots to not just care home staff, but to local authority frontline staff in general, alongside health staff. So I think the first 2 weeks we've opened up all the slots to local authority staff, trying to get as many of not just care home staff that we've already vaccinated quite a few of, but actually domiciliary providers and all of your sort of local authority frontline staff will be offered the opportunity to get a vaccination. So really the message out to everybody is go for it, get the vaccine. I think it's been a little bit slow, the uptake, with regards to care home staff particularly, and I know sort of West Berkshire have fed that back. I think there was a little bit of a reluctance. The vaccine's new, and it's about sort of getting the message out there that it's safe, and that actually the safest thing to do is to actually have the vaccine. So any help with that will be really, really appreciated. So obviously, in addition to that, we started running our PCN vaccination programme. The PCN vaccination programme was aimed at being delivered over a 4 to 6 week period, with PCNs coming on a sort of intermittent basis. And we had to sort of plan to stagger that because of the availability of the Pfizer vaccine and how sort of quickly we could actually get it. So I'm pleased to say that all of our PCNs right across Berkshire West, so that includes all the PCNs in West Berkshire, will all be live by the end of next week. So we've managed to achieve it in 5 weeks, which I think is pretty positive. It's taken quite a lot of organisation, as you can imagine. So that's delivering the Pfizer vaccine. So I'm officially not supposed to actually sort of give you sort of information around sort of sites, but I have seen that it's been publicised. So we all know in Newbury that actually we do have a large vaccination centre for the PCNs coming on next week. It just has to be formally approved by NHS England, but I do believe that will be a formality. And so next week we will be vaccinating from Newbury Racecourse, providing it goes through the formal approval. And that's a collection of our PCNs. So they'll be delivering quite large numbers quite quickly, which is really positive. So the PCNs are their cohort of patients that they've been given the task to deliver the vaccines to the over 80 population as far as possible. So that's their first priority, and also to care homes. So some of the PCNs took up a very late offer of splitting the Pfizer vaccine to actually in boxes of 75, and they were asked if they could go out to care homes that are over 50, but very few were able to take that up because the ask came out on Christmas Eve. It was just almost impossible to sort. But I'm pleased to say that, as you would have all heard, the AstraZeneca vaccine has now come on live. All of the PCNs that have actually gone live with their vaccine, so up to wave 5 for this week and then wave 6 next week. So all of our PCNs as of next week would have actually had a delivery of the AstraZeneca vaccine. So they're all getting, my understanding is they're all getting 400 vaccines per PCN. So, and they're going to use those vaccines to actually largely go out to care homes. We think that we're waiting for the direction, but that's the way that most practices and most GPs are considering that is the best way to use their AstraZeneca vaccine, because there isn't the same restrictions around moving the vaccine and also keeping it in, they can keep it in a normal fridge like they do their flu vaccine. So I think they will largely sort of be taking their vaccine out to care homes and trying to get through that cohort. And when they go out to the care homes, they can actually vaccinate the care home staff as well. So any care home staff that haven't actually been to one of the hospital hubs or the vaccination centres, because they're also offered to go to Oxford University Hospital as well, being that West Berkshire's nearer to there for some staff. But any staff that haven't taken up that offer will be offered the opportunity to have their vaccine when the GPs go round and do the care home residents as well. So hopefully we'll sort of encourage more care home staff to actually have their vaccine that way. So sort of by the end of next week, all of our PCN sites will be live. We'll be prioritising over 80s. We'll drop down to over 75s if they need to use the vaccine up, but not going any lower than that. we'll actually also do their sort of PCN staff in addition to that, because I think we've got quite a lot of outbreaks in our practices, small outbreaks, but nevertheless outbreaks. So we need to make sure that we get our practice staff actually vaccinated as well. And then the hospital hub will focus on the social care and health staff. The other hospital hub, Royal Berkshire Hospital, actually also is gone live this week. So that's really good news as well, because they will be starting with their staff for the first couple of weeks, but then they will be opening that up to wider staff across health and social care as well. So, and then we've also got a couple of PCN sites that have lower numbers of over 80s, and so our plan is that once they've done their over 80 population, that they will also open up their sites to actually support the other PCNs to get through the ask of doing the over 80s as soon as they possibly can, and also to do the care home and social care staff as soon as possible alongside the health staff. So I think that's probably as much as I can actually sort of share with you, but happy to take any specific questions or comments.
I've got questions firstly from Steve Masters.
Thank you very much. Thank you, Debbie. Quite a comprehensive brief there. Just a couple of questions. A few people have raised a couple of issues. With people who are socially isolated in the over 80 category, is it thought that the PCNs will be going out to people who can't get to the practices, or how is that going to be, or how's that going to be, the mechanics of it?
Yeah, so I think that's what we've been waiting for the AstraZeneca vaccine for, because actually allows us to take it into people's homes. So we're just working with BHFT, so Berkshire Healthcare colleagues. So it's going to be a combination of the district nursing service and the practices themselves actually doing the housebound patients. So the first doses of the AstraZeneca vaccine is literally coming this week to practices. So as soon as they get it in their hands, we'll be working with district nurses, and also GPs will be doing sort of house and their practice nurses to do the housebound patients. So yeah, we'll be taking it out to the patient's own home when they can't get in. But actually, largely families have been bringing patients in wheelchairs. We've had a lot of patients pitching up that haven't been out for a long time. But yeah, there will be some housebound done at home.
And just in addition, is there? I know the landscape's changing by the hour, as you say. Is there any plans for vaccinating teachers? Around the concerns.
I think the answer to that is I'm waiting to hear what Boris says tonight. I think there's a strong possibility that there may be an ask for teachers. At the moment, the cohort is health and social care staff in categories 1 and 2 is what we're being asked to vaccine. But it does change daily, and we are expecting an announcement tonight around sort of an update from Boris Johnson. So we'll see whether that changes anything, and it wouldn't be surprising if it didn't include teachers. But I haven't heard anything yet about that.
Thank you, Debbie. Thank you.
Joe, I just wanted to give an explanation.
Sorry, just been asked to clarify that a PCN refers to a primary care network, which is a GP practices, just for the benefit of any members of the public.
Apologies. Thanks, Joe.
Ganses Bridgman.
Yeah, thanks. Debbie, there was some discussion early on at the point that they were discussing Pfizer, with the knowledge that AstraZeneca would be coming on tap in due course, in the media about clinical fridge space, because obviously with AstraZeneca, as I understand it, correct me if I'm wrong, we're not talking about domestic fridges. We are talking about specialist fridges in surgeries, PCNs, hospitals, wherever those fridges are stored. And there was a concern that at the point that they were having that discussion, the fridges themselves were full up with flu vaccine, and there wasn't a lot of space to put any new vaccines in. So I've got a number of questions. The first one is, are we satisfied that the PCNs, and more to point, the surgeries, have the fridge space for AstraZeneca as it gets rolled out? Then in terms of the AstraZeneca rollout, and I was interested in the response to the question about, and I'm just going to say key workers over and above the ones named in category 1, category 2. So carers in care homes, frontline NHS, and general staff in care homes who are on the list, and certainly I've been asked about other individuals in a frontline type capacity, and teachers is obviously one of those, but there are a number of other areas where you can think of people who are key workers, and whether there's been any indication other than an announcement that might be coming online to move the goalposts for those. And in particular, if we're talking about AstraZeneca rollout, is the centralized sites, like, for example, hospitals and in particular racecourse, really for the Pfizer vaccine because of the difficulties in delivery? Or is the intention that they might well be used for AstraZeneca as well? Or is AstraZeneca going to be rolled out in more of the pattern like flu, and in terms of going into people's homes where they can't move? And from my point of view, very critically, going into care homes, because we know care homes are top of the list, but the difficulties in rolling Pfizer out to them. So with AstraZeneca, are we expecting that there will be an immediate rollout to care homes, and that 50 limit, because that was a Pfizer limit, isn't going to apply, and we're going to get a rollout to all the care homes in West Berkshire?
So I think, I don't know if I remember all of those questions. You'll have to sort of prompt me. So I don't have all the answers as to how much of Pfizer, how much of AstraZeneca we're going to get. We just don't know that yet. All we know at the moment is the GPs, the PCNs, the primary care networks, are all getting the first cohort of 400 vaccines of AstraZeneca. That's as much as we know about the AstraZeneca. So absolutely, the plan is to use that 400 as quickly as possibly can, and I think there will be some guidance coming, but there's nothing yet. So I think whilst we haven't got that guidance, most of the GPs I've spoken to are going to use that for care homes. It makes sense to go out to the care homes and also to use that for housebound patients as well. So patients that actually can't come into clinics that they're setting up, because there's not the same restrictions around moving that vaccine. So actually it's able to be transported from the practice to the care home or to the patient's home without any issues, whereas you can't do that with the Pfizer vaccine. So that's the first thing. And I think most of the GP practices and the PCNs are quite keen to get through their care homes pretty quickly, as quickly as they are able to. But that is dependent on the vaccine. They only have a first dose of 400, and we don't know when they're getting the next. That's in answer to your first question. We just haven't got that information at all. With regards to the fridges, I've not had any GP practice as actually raised that as an issue yet. With regards to the Pfizer vaccine, once they actually get it, they get it defrosted, and they have to use it within 3.5 days. So actually, they've literally, as they've got their Pfizer vaccines, it's all gone. And most of the time, they have the delivery, and then they've delivered it. Most practices of PCNs have done it over 2 days. So actually, the Pfizer vaccines, the storage isn't really an issue, because it has to be used as soon as it's arrived, more or less. I think that most of the practices feel that they can adequately store the 400 vaccines in their fridges. I haven't heard anything different to that. So, and if they need more fridge space, then we will provide that. But that's not being raised as a risk area. And I can't remember, you had a third question.
Yeah, it was about racecourse, and whether racecourse is very much because of the difficulty in delivering Pfizer, or whether the intention is, as AstraZeneca comes on stream, that racecourse will still be a centralized hub, as it were, for vaccination, or is the intention to do it more like flu, out into the community?
I think as far as we know at the moment, the racecourse is the hub for the PCNs. That's where they've agreed to actually sort of deliver from, to do it in a coordinated way. For the foreseeable future, it will be week after week for the racecourse. Because once the PCNs go live, then they then get follow-up Pfizer vaccine pushed to them. So it's not even an ordering; it will just follow on. So don't know anything different to that. I mean, if you're asking me, my opinion is that ultimately, by the time we get to the end of February, maybe we'll get to a point where GPs largely have AstraZeneca vaccine, and they will actually deliver vaccine in the same way as they deliver their flu vaccines on a sort of Saturday clinics and into patients' homes and into care homes and all that kind of thing. They would just do it sort of that way, and Pfizer vaccine will ultimately be used for, like you say, big mass vaccination centres or the hospital hubs or something like that. But we haven't got any confirmation on that yet. It's all sort of just guesswork at the moment.
Thanks.
Councillor Doherty.
Thanks, Debbie. That was really useful. Debbie, a lot of residents are asking how they will hear when they're to come in and when they'll get appointments. Can you just give us clarification about how you'll actually hear about it? Will you get a letter or will you get telephone call, text? What will be the process?
Yeah, I think all of those ways, but it won't be letters. It's because of the turnaround. Most of the practices, most of the patients, my understanding is they're getting a telephone call or a text message or both, actually. So we're supporting with some additional admin into PCNs, and we've actually put a request out for local authority support with that as well, if there is any. I know Helen put that email out this week. We're obviously being asked to actually coordinate a huge vaccine program and invite a lot of people in at fairly short notice, and I think sort of generally the way to do that is to actually phone, particularly the over 80 population, is to actually give them a call, send a text, but also give them a call to follow up. So I think largely they're actually phoning the patients and actually booking them in.
Okay, thank you. And you mentioned the over 80s, the over 75s. Have you had any indication on timelines when we go further than the over 75s?
Oh, there's a whole wave there's an actual list of cohorts that we go down from sort of and in which order, right down to wave.
Yeah, I'm aware of that. I'm just wondering if there's any timeline against any of that.
I don't think there is. I think, to be honest, it's just going to be about availability of vaccine and how quickly we can get out through the cohorts. But I think we're anticipating having done the over 80s by sort of the end of January if we can. We're really going to sort of try and push that, but can't promise that. It's just going to be availability of vaccine, but that's the aim. It's the aim to get out to all of the over 80s that will accept the vaccine, because not everybody is saying yes to it.
Okay, thank you.
Councillor Bakers.
Thank you. Thank you for that. This is all very informative. Yes, my question is about the priorities for those getting the vaccines. Is that priority, is that flexible? Can we decide ourselves on our priorities? Or is it national? You're shaking your head.
No. Yeah.
It's national, because I was just thinking that we talk about key workers, and obviously health workers, care workers are crucial here. But we've got so many people who are out there working, who have to work, who can't work from home. I'm thinking particularly about our shop workers and others in quite low paid work who are quite at risk here. And surely they are key workers. And will they be given any priority over this sort of slowly going down the age range? Because to me, that seems more important to get them vaccinated than it has to slowly, because we can see locally that our over 60s, the rate in infection, from what I remember previous statistics, is going down. And the bulk of infections is in that working population who are out there having to work, having to go out, having to do the jobs that the over 60s don't need to do anymore in a lot of cases. And it seems a bit, it seems to be a wrong priority not to be focusing a vaccine on these people who can't work from home and are out there in the thick of it.
It's a good question, and people have raised it because there have been some sort of viewpoints that, yeah, exactly that. Why don't you vaccinate the sort of middle-aged group, because actually they're the ones that are out there passing it around. But the national decision and the national direction following the clinical advisors is that we're vaccinating people by way of those that will be most likely to die of COVID. I mean, the long and the short of it is that. So we're prioritising the over 80s because actually, if somebody in that cohort gets COVID, they've got a much higher death incident than someone that gets it in their 40s or 50s. I think sort of we did have a big issue, didn't we? And we know that actually we had a BAME issue in wave 1, but actually we're much better at treating COVID than we were in wave 1. We've got sort of people actually recovering much quicker from COVID this time. But the exception to that is the over 80s with lots of comorbidities, and the older population with lots of comorbidities still don't do as well. So that's why the national, it is very prescribed. It's literally tells us who we need to vaccinate when, and it's very much done by the clinical advisors to the government, actually giving their advice on who needs to have it because of the risk factors that they have that's greater than other members of the population. So hopefully that answers your question, but yeah, you're not the first one to answer it.
Matt.
Yeah, thanks, Chair. Yeah, just to echo what Debbie said, obviously they make a judgment in terms of those population groups that would likely suffer the worst, but also pressure on the NHS. But obviously, just to pick up on the point Debbie said, we don't know about the vaccine and transmission yet, so we only know that it actually prevents the severity of the disease and the symptoms, rather than actually whether somebody can pass the virus on to others. So the evidence isn't clear in terms of the effectiveness of the vaccine on transmission rates yet, and that's just one thing we just need to bear in mind.
Councillor Bridgman, is that an old hand?
No, it's a new one. And it was really just a comment that I was a bit surprised by the question, because the list of those who are in line to be vaccinated is explicit. It's been out there for a long while. We know what it is. It's care homes, care workers, 80 plus, and frontline staff, then 75 plus, then 70 plus, then 65 plus, then the 16 to 64 group who are vulnerable. And as and Debbie answered the question as I would have done, which is you're not trying to stop people passing it on. You're trying to stop people dying from it. That's the fundamental, I think, to the vaccination program at the level that it's being delivered. We're trying to stop people dying, and the people who are dying are the elderly, and that's the group we've got to vaccinate.
We are running on time, but Councillor Vickers, you want to say something else?
Well, I mean, it's just I had my answers, and thank you very much. Things are changing, so I thought it was worth asking the question. I'm aware of what the priorities have been over time, but I still thought it was a question worth asking. And possibly if anybody of the public is watching, hopefully they might have found the answers useful. And I think among the group I mentioned, there are a lot of health issues, health inequalities as well. So I mean, it's a difficult issue, but thank you for the additional facts, Councillor Bridgman, but I thought I had a very explicit answer from Debbie. Thank you.
I think that's all the questions we have. So thank you, Debbie, for sparing the time to join us. I know you're very busy. Much appreciated. Thank you very much. And if we can now move on to
Thanks very much, everyone.
Pleasure. Good to see you. If we now move on to the situation report and instance by Matt.
Yeah, so evening, everybody. I'm just going to take you through the latest position in terms of our epidemiology and the number of cases. So just to clarify where we are in West Berkshire and also the whole of Berkshire, we are still in tier 4, and I think we've already mentioned this evening that we're expecting an announcement by the Prime Minister 8 o'clock tonight. So we'll await to see what is announced in terms of any additional restrictions that might be mentioned. As we know, the local alert levels they tend to be reviewed every 2 weeks, but I suspect that some more restrictions might be coming into place a bit sooner than that. In terms of the overall picture for West Berkshire and Berkshire as a whole, so as West Berkshire, we've had just over 3,500 confirmed cases so far. And we've had quite a significant jump in the positivity rate in West Berkshire now. So I've highlighted West Berkshire in yellow on this particular slide. So our positivity rate is around 16.2% now. So around 1 in 6 potentially now who are turning up to be tested are testing positive. If we go back to the beginning of December, that rate was around 3.9%. So nearly a 3-fold increase in about 4 weeks' time. If you look at the cases per 100,000, again, that's risen significantly. We're now at 377.4 per 100,000. That's of all ages. And again, if we go back to the 1st of December, that was around 50 per 100,000. So nearly a 7-fold increase or 700% increase in the number of cases over a 7-day period since the beginning of December. So clearly not going in the right direction. If you have a look for our cases per 100,000 for 60 or more, that's at around 223. So high, but it's lower than our peers and also the regional and national average. And then if you compare our overall cases per 100,000, again, against the South Eastern national average, we are lower, but still all local authorities in Berkshire are going up in terms of positivity, rates per 100,000 all ages and 60 plus. And over the last 7 days, there's been 598 new cases. So clearly we're in a difficult position in West Berkshire, as are our neighbouring local authorities. And if you look to the east, in Slough in particular, their cases per 100,000 are over 1,000. So clearly probably one of the worst positions we've been in this part of this pandemic. But do bear in mind that obviously we didn't necessarily have as much testing availability in the first part of the pandemic. In terms of the cases per 100,000, again, this just shows it on a map. West Berkshire right in the centre of that map, and you can clearly see to the east of West Berkshire and north and south in Vale of Whitehall, South Oxfordshire, many of those local authorities are showing high number of cases per 100,000. So just to reiterate the point that you know, we're not alone, and I think it's clearly the new variant of COVID is playing a significant part in this rise. Again, this slide just gives you an illustration of how we compare nationally and regionally across each of the 6 local authorities. Over the whole of the pandemic, there's been 30,818 confirmed cases, and 85% of those in Berkshire have occurred since the beginning of October. So again, you know, largely down to more testing, but now we are probably seeing more cases than we ever have been as part of this pandemic. The epidemiology of cases, so this really just shows you the age-specific case rates per 100,000, and I thought this might be quite interesting given conversations around schools, and I think Councillor Vickers mentioned the age rate per 60 plus or more as well. So on the left-hand side of this graph, we've got the age groups, and at the x-axis at the bottom, we've just got the daily rates per 100,000. The darker the colour goes, that just shows the higher rate for that specific age group. So, you know, between the ages of 16 to 64, we're seeing increases in the rate per 100,000 for those specific age groups. We have seen quite a significant jump, particularly within the 16 to 29-year-olds. In terms of 0 to 15, whilst there was a rise up until kind of the middle of December, late December, that's slowly coming down. But again, it'd be interesting to see how that progresses over the next few days, and whether schools will remain open pending the announcement of the Prime Minister later this evening. In terms of deaths, sadly, there's been 155 deaths during the pandemic. 3 deaths were recorded in the last week. And since March 2020, our all-cause mortality rate maintains to be around 20% higher than the previous 5-year average, which equates to around 187 additional deaths. In terms of the hospital activity, and I'm sure many of you will be aware, it is a key factor in terms of, I guess, what might be announced later by the Prime Minister, and it's one of the criteria for assessing tiers and restrictions is the demand on our health services. On the 30th of December, there were 179 patients in the Royal Berkshire Hospital with COVID-19, and 18 of these were on mechanical ventilation, and the number of admissions are also increasing. So clearly this is a concern, and this is affecting the whole of the southeast region of England, and there doesn't seem to be any signs of it easing at any point in time. In terms of outbreaks, again, this is just reflected in the numbers. I don't think this table actually covers the entirety of all the outbreaks that we're dealing with. These are mainly the ones that are reported through to Public Health England. We're also receiving lots of notifications from outbreaks across West Berkshire. The number of outbreaks in schools have eased, particularly over the last couple of weeks since the Christmas break, but we're continuing to see outbreaks in care homes and workplaces. Clearly, we had the Willow's Edge care home. We had a significant outbreak there, and sadly, a few deaths as well. But without a shadow of a doubt, again, we're providing lots of support to all sorts of different workplaces and individuals, trying to manage outbreaks as best we can. And again, this just shows you an illustration of the map of West Berkshire and where we're seeing some of the highest rates. Those in dark blue are those where we're experiencing rates of 250 or more per 100,000 of population per ward. There does seem to be a cluster perhaps around the region, but to the north and to the east of the district, we're also seeing high rates of COVID-19 as well. But as throughout this pandemic, that doesn't necessarily always seem to be much of a pattern to where these cases rise. But obviously we're doing all we can to support those individuals through contact tracing and support outbreaks in those areas that might contribute to those high rates. So in summary, I said we remain in tier 4 as things stand. We'll await to see the announcement this evening to see what additional restrictions might be. We've had just over 3,500 confirmed cases so far, 581 in the last 7 days. The weekly rate is 377.4, is high, but lower than the regional and national average. And our rate for people aged 60 or over has increased to 223 per 100,000 of the population. And sadly, there's been 3 deaths recorded in the last week, and that was between the 12th and 18th of December. As always, for those watching, members and colleagues, please keep up to date by visiting berkshirepublichealth.co.uk website. As I said, it's getting more and more populated all the time, and there's some really good widgets on there where you can enter your postcode and they'll tell you exactly what restrictions apply to your area and what you can and can do. So that's all from me. Thank you, Chair.
Thank you, Matt. I see questions from Councillor Doherty.
Thanks, Matt. Thanks for your presentation. Matt, I just wanted to go back to the first slide, and obviously we saw a really rapid rise of cases. And I think at the last LOEB, we discussed how at the start of December we're at 50, and we saw that real spike. The cases, although it's still increasing, has it slowed down the percentage increase each week? Has that slowed down? I'm just thinking we've now had nearly, 2 weeks at tier 4. Do we think we're seeing a slowing of case rises, or do you think that's just coincidence?
There has been some indications of that, but I'm a little bit nervous to say otherwise, just because the testing's been a bit frantic over Christmas, and we're not getting that full picture of the data yet. So clearly, I think we would start to see now the effects of if there was Christmas mixing, if people did go and see their loved ones, which is perfectly within the legislation and guidance put out, we might start to see that data now. I mean, I don't know if Meriden has a view in terms of whether it's slowing down, but I think we're going to have to wait to see how it goes over the next week or two, I think.
Okay, thanks, Matt.
I'm happy to comment. The rise over the last 2 weeks is still significant, but not as fast as the first 2 weeks. But it's still in line with, if you think about Kent and their rapid rise, they were very low all the way through the early part of the pandemic, and their rise was exponential. We are on that curve potentially. I think the impact of Christmas and being in tier 4, we won't see for another week. You need to wait 2 weeks to see the impact. And what we're seeing in the hospital admissions is a direct result of the increases 2 weeks ago. So as we rise, in 2 weeks' time, that significant rise will still happen in the hospitals, which is why the hospitals are pretty much at critical point.
Okay, thanks, Meriden.
Just to add, Councillor Doherty, I think in some of the other areas where there has been a tier 4, there doesn't seem to be any signs of tier 4 actually making a difference on some of those significant increases. It does vary in terms of demographic composition, in terms of rurality and urban, but that's what we're seeing elsewhere in the southeast.
Okay, thanks, Matt.
And actually, what's interesting is Kent is starting to decrease, but they're still around the 700 per 100,000, and they've still got one of their patches over 1,000, but they are starting to decrease. And there didn't seem to be any impact from the second lockdown, but it's possible it's either the early moving into tier 4 or the mass testing that they've been doing. They've had the army in doing mass testing of schools. So there's a couple of things they've been doing that might have made the impact in Kent, which we need to look at and learn from.
Councillor Masters.
Thank you. Thank you, Matt. That graph with the heat graph, I think, was quite telling, and I think that brings the seriousness of the situation home quite robustly. And I think it does actually reinforce Martha's point about how it's, many of the key workers, including shop workers. So I do think Councillor Bridgman's slightly aggressive response to Martha was a little bit of out of order, to be honest. So, but thank you for that, Matt. I just have a question. There was a lot of talk about how impact Slough had in the first lockdown and that sort of time frame. Up until very recently, we still had more deaths in West Berkshire than Slough had, despite the high rate of infection in Slough. Is that down to anything in particular, the rural nature of our district? I know they've just overtaken us in the last couple of days on the data. I've been watching quite closely. I don't know if you had any thoughts on that, Matt.
I'd have to look into that data, actually. I mean, my guess is the age profile of West Berkshire. We've probably got an older population in Slough, and that's probably been the main contributing factor to the higher death rates. But no, that's something I can certainly look into to see if we can find out why that might be the case. It could be also that we might have more care homes in Slough. I don't know what that proportion split is between care homes in Slough and West Berkshire. So there might be a number of different factors that might have contributed to that.
Just before, sorry, Chairman, I was just going to, in terms of overall death rates and the ages of the current round of deaths. I know we've had deaths in the care homes locally. Nationally, is there any change in the number of deaths in the younger population at all?
Again, I don't know if Merlin has any answer to that. I'd have to look at the national data coming through. As far as I'm aware, it's still very much targeting the older population and also those people with long-term conditions. What we do know, though, is actually that long-term condition definition used by the local government, so the national government, is quite broad. It covers a whole host of different conditions. So as far as I'm aware, it's still very much focusing on people with cardiovascular disease, chronic obstructive pulmonary disease, older age. Although saying that, it does, attack people, healthy young people, and you've just seen that in the news. And also, I think we've made the point before around the long COVID as well. So it's not just the older, not everyone's vulnerable. Anyone of any age can get COVID, and it can give, a range of different consequences, whether that's fatigue, tiredness, and we're still learning more and more about this virus.
Councillor Bridgman.
Well, since Councillor Masters has raised it, I will defend what I said, which is simply to reiterate that there is very good reason for vaccinating as a priority. And I'm not saying we shouldn't seek to vaccinate everyone, but as a priority, those who are most at risk of dying as a result of COVID. And as Matt has just said, that indication is that it is the elderly that are most vulnerable to death from this horrendous disease. And that's not to say that anyone who is in a younger age group and has a vulnerable health condition isn't on the list. They clearly are. But the question I wanted to raise with Matt was about the testing regime and the rates that you're showing in the first slide about numbers being tested and the rate within that number that proved positive. I am correct, am I not, that that is a reflection of Pillar 1 and Pillar 2 tests, and therefore the whole thrust towards lateral flow tests won't flow into those numbers, presumably because there isn't a particular way of capturing that data, because the way in which the lateral flow testing regime is being rolled out doesn't allow you to say, right, we've had this number of positive lateral flow tests out of this total number of tests taken, and roll that into the number, and that this is very much a lab testing number that we're looking at.
That's a good question. I know they are starting to monitor the lateral flow device results, and my understanding, again, I'm probably looking to Meriden for her input on here, is that it is a notifiable disease. So anyone undertaking a lateral flow device, and if there's a positive, then that should be notified. But whether that will be part of those positivity rates at this moment in time, I don't think so. I think that's Pillar 1 and Pillar 2.
Just to reflect on that, Matt, because I thought, yeah, hang on a minute, if you get a positive lateral test, you go on to take a lab test and have it proved or not proved. But the problem there isn't it that whilst you pick those individuals up, you're not recording the total number of people who are having lateral flow tests, because if they're getting a negative result, they're not going on and being recorded somehow. Otherwise, I mean, particularly when lateral flow tests are rolled out to the schools, you're going to have vast numbers of lateral flow tests being taken on a weekly basis. But how are we going to record that positivity rate within those tests?
Yeah, I know they are recorded. Meriden, do you know the answer to that question in terms of whether? Yeah, she's got her hand up, thankfully.
And the other one. I mean, my understanding is that the lateral flow tests are not being concluded in the data yet. They are being recorded, but they're not being included. And so anyone who's got a positive LFT will have a PCR, and if that's positive, it will then be counted. So, for example, there were something like 4,500 tests done at Reading University and 15 positives. Those 4,500 weren't included, but the 15 that went on to have PCR tests, anything positive will then have been included. So you're right, they're not yet being included. And
just to develop and just to go back on a little bit more about the lateral flow test. I mean, one of the and I'm interested because this is a question that was raised in respect of some email traffic I had regarding dementia residents in care homes and testing for pre-tier 4 testing in relation to visitation. What I understand, again, please correct me if I'm wrong, but what I understood from that conversation and other conversations around it was that lateral flow tests are far more accurate where the individual has a high viral load. And one of the concerns about lateral flow tests is that they weren't picking up individuals that had a lower viral load. And that was one of the reasons why they might not, well, they certainly aren't anywhere near as accurate as what I'm going to call lab tests.
That's
but that with the new variety of COVID, let's call it COVID-2, that itself has a much higher viral load than COVID-1. My question, therefore, is it likely that lateral flow tests will pick up more of the population? Because as I understand it, the current rate of infection is roughly 80 COV-2 to 20 COV-1 in the general population across the country. So it's about an 80% COV-2, and if that carries with it a higher viral load, you're more likely to pick them up through lateral flow testing.
That's a very good deduction, and it sounds very rational. I think we don't know enough yet. What we do know is they have confirmed that the LFT does pick up this new variant. It does pick it up. What we don't know is the level of pickup or about the viral loads. But from what you're saying, it sounds very rational, probably is the case, but I can't confirm that at the moment.
I think just to add, I think that that there's some emerging evidence actually it's more transmissible at a lower viral load with the new variant. So they might not necessarily have a higher viral load, but it's more transmissible at a lower viral load. So there's lots of unknowns. Just to let you know, I just had a quick look at the COVID dashboard. It is now reporting the number of lateral flow device tests that take place in West Berkshire on the gov.uk website, and that does include those tests that have been taken that have been positive and void. So yeah, I imagine I'll try and find out some more detail in terms of whether that data starts to get included in the positivity rate, Councillor Bridgman, and bring that back once I've looked at definitions.
I think that's the end of questions on that one. So if we could move on to communications update from Mandip. You're on mute, Mandip.
Sorry.
All right, thanks.
Oh, I thought I had unmuted myself, but obviously not. Good evening. It's only going to be a short update because it's just a follow on from what we did 2 weeks ago, really, which has been much of a focus around all obviously the tier 4 restrictions, and over the Christmas period, just keeping all of our channels updated about kind of, Christmas bubbles or not Christmas bubbles, etc., and just updating people over this information via social media, our newsletter, press releases, graphics and videos. We put a video up from one of the doctors as well to kind of explain a little bit more about COVID, etc. And we've also translated the Tier 4 poster, the one that's got a grid with all of the information on it, and that's up on our website as well. And it's translated into 4 languages, which is Hindi, Polish, Portuguese and Urdu. So for anyone who needs to go and have a look at that, I would suggest they go to the coronavirus page of our website, and it's the residents page, and it's listed at the bottom just there for anybody. We have also put a statement out today about our position with primary schools. So that was kind of a bit of a quick turnaround today to get that out and on there. We have been working with Public Health Berkshire, and they've got some assets as well that they have put together on their social insight survey that they did. And they have sent over some new comms and graphics and straplines that we can use, which they're kind of quite short and snappy, and they're actually appealing more to young adults. So if we're kind of looking at that heat map that Matt showed earlier, it's kind of a target market that we can actually sort of focus on, but that obviously is dependent on what happens in about an hour and a bit from the announcement from Boris. And the last bit really is that we are looking at doing some supportive comms around the vaccination. Obviously, it doesn't come through from us, it's from the NHS, but we are on hand to support any of the key messages that needs to be put out about that, really. And once we know a bit more, then yes, we're more than happy to support that. But we're still continuing with the messages that we have going at the moment, and we're on hand for tonight when the announcement comes out. So we will try and get out as much information as we possibly can as we hear it, as it happens. And then that concludes my comms update.
Thanks, Amanda. I can't see any questions for you. So we'll move on to agenda item 7, which is items for future meetings, if anybody has any suggestions. Councillor Doherty.
I found Debbie's update really useful, and I don't know whether it's worthwhile in a 2 weeks' time, perhaps asking one of our GPs, or Joe, I don't know if you've got a suggestion for who, to actually come back and tell us how the rollout is going. So obviously it starts on the 11th, and I think the following week we'll be having an LOEB. It'd be quite useful to actually hear how that's going.
Yeah, certainly we can find an appropriate person to make that update.
Thanks, you. Which moves on to any other business. I've got one, which is that my one of my stepsons was tested positive, so I went for a test at Newbury Racecourse. And I can't speak highly enough of the process and how quick and easy it was. I see Councillor Masters. You're on mute, Councillor Masters.
Oh, sorry. My apologies. You'd think we'd have all got used to the mute by now, wouldn't you? I know there's in a press release about the schools go out from the comms team today. Many of the people who are watching may not have seen or heard that. Is it possible that somebody could give an update on what that position is in regards to the schools?
Dominic, do you want to make a comment?
Yes, thank you. Thank you, Chairman, and thank you, Councillor Masters. It's quite clear that there's a very mixed picture across West Berkshire. Different schools have different challenges, and all through this crisis, our head teachers have given really outstanding leadership. And our position, the position that Mandeep referred to, the Council's position is that we will continue to support our head teachers in making decisions that they have to. What that has led to is that some schools have closed largely or many of their year groups, although all schools remain open for vulnerable children and children of key workers. And many of our schools are open for all of their year groups.
Could I just ask, I know you in the press release you spoke about the conversations with the various education unions and other unions for support staff. Are those conversations ongoing, Councillor Bowick?
I'm sure that the unions are talking to the head teachers.
Councillor Vickers.
Thank you. Yes, I possibly should have just raised that with Mandip, but I was just thinking, going back to the point that was made earlier about having had the vaccine, you might be protected from getting COVID, but we're not sure about whether you can't transmit it. I think a lot of the members of the public will not differentiate here. So as the vaccine is rolled out, I think it's probably important that we actually get that message across, that you can still infect people even if you yourself might be safe. Do you think that's a valid point? It's just something that a lot of people will think, well, I'm safe and now I can't transmit it either. Or is there more information ongoing? Will we soon know a little bit more about whether people can transmit the vaccine?
I think we're in the land of not really knowing at the moment, to be honest, Councillor Vickers, but I think we should wait for a few weeks or a week or certainly and see how it pans out.
But at the moment, we should be making sure that people don't think that they are safe to mix with other people once they've had the vaccine, because this is the message you're getting from people, really, that they think that they can then go out there and do whatever once they've had the vaccine. But maybe, hopefully, we'll soon know for sure.
Matt.
Yeah, I think it's just to add, I think there is some comms needed about what the vaccination means. I don't think we really talked at length in terms of the 2 doses as well, and obviously that's been extended 12 weeks apart, not 3 weeks apart. I think there's some comms there, but you're right in terms of also PPE. People still need to wear PPE even if they've had the vaccination. So there is some comms to be done, that people still need to be cautious, and unfortunately there is going to be a long time to come. To get out of the woods, and we still will need to practice social distancing and face coverings for some time to come yet. So whilst it is positive news and don't want to put a down on it by any means, we need to be pragmatic and realistic in terms of what people still need to do even if they've had the vaccine.
Councillor Moss, is that an old hand?
No, it was just a point that somebody just messaged me actually. We know how vital the voluntary sector has been in some of the mitigation and support during this pandemic. And we have frontline care systems in place with the voluntary sector, such as the soup kitchen and loose ends, etc. Is there any plans in the medium term or in the in the short term to get them? Do they qualify as support workers in the same way as care home staff and domiciliary care, etc.?
Is that a question to me?
I think it is, Matt.
Oh, right, sorry.
To anybody who can, anybody who can answer it.
Is that in terms of vaccinations?
In terms of vaccinations, yeah. Sorry.
Yeah, well, I mean, I think that would be the same. I mean, that's a question we'll have to take back to Debbie, I think, in terms of how they're prioritising their staff. Again, I think it's quite rigid in terms of what's being recommended by the JCVI in terms of those priority groups, but I'm sure that consideration could be given, and if they fit within one of those categories, then they might consider that. So I'm happy to take that away and speak to Debbie, if that's helpful.
Yeah, that would be very helpful, Matt. I'll maybe liaise with you offline.
Okay.
Can't see any other raised hands, so I think that concludes the business of the meeting. Thank you for attending, and I wish you all a happy and healthy new year.